Good morning everyone. It's me Sanju Pandit. Welcome back to channel Medical with Sanju. Nepal Nursing Council Model Exam Set-19b. Question number 76. A 60-year-old male client comes into the emergency department with complaints of a crushing chest pain that radiates to his shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Immediate admission orders include oxygen by NS at 4 liters per minute, blood work, chest X-ray and ECG, and 2 mg of morphine given intravenously. The nurse should first. Option A. Administers the morphine. Option B. Obtain a 12-lead ECG. Option C. Obtain into lab work. And option D. Order the chest X-ray. The right answer is option A. Administer the morphine. First मा चाहिँ pain relief गर्नको लागि morphine दिन्छ. Although obtaining the ECG, chest X-ray and blood work are all important, the nurse's priority action would to be relieve the crushing chest pain. So morphine should be administered. Question number 77. Which of the following terms is used to describe the amount of stretch on the myocardium at the end of diastole? Option A. Afterload. Option B. Cardiac index. Option C. Cardiac output. And option D. Preload. Option D. Preload is the right answer. Preload is the amount of stretch of the cardiac muscle fiber at the end of diastole. The volume of blood in the ventricle at the end of diastole determines the preload. Question number 78. A client has driven himself to the emergency ward. He is 50 years old, has a history of hypertension, and informs the nurse that his father died of a heart attack at 60 years of age. The client is presently complaining of indigestion. The nurse connects his to an ECG monitor and begins administering oxygen at 2 liters per minute per NS. Next action would be to option A. Call for the doctor. Option B. Start an intravenous line. Option C. Obtain a portable chest radiography. And option D. Draw blood for laboratory studies. The right answer is option B. Start an intravenous line. Question number 79. Which of the following blood test is most indicative of a cardiac damage? Option A. Lactate dehydrogenase. Option B. Complete blood count. Option C. Troponin first. And option D. Creatine kinase. The right answer is option C. Troponin first. Troponin first level rise repeatedly and are detectable within 1 hour of a myocardial injury. Troponin levels are not detectable in people without cardiac injury. Question number 80. A client enters the emergency department complaining of chest pressures and severe epigastric distress. His vital signs are 150 by 90, 94, 24. भन्नुको अर्थ 150 by 90 blood pressure, 94 pulse and respiration 24 and 99 °F temperature. The doctor orders cardiac enzyme. If the client were diagnosed with an MI, the nurse would expect which cardiac enzyme to rise within the next 3 to 8 hours. Option A. Creatine kinase. Option B. Lactate dehydrogenase. Option C. LDH first. And option D. LDH second. The right answer is option A. Creatine kinase rise in 3 to 8 hours if an MI is present. When the myocardium is damaged, CPK, creatine kinase, leaks out of the cell's membrane and into the bloodstream. Question number 81. A 12-year-old male client is admitted to the psychiatric unit with a diagnosis of schizophrenia. Acute episode. He is having auditory hallucination and seems disoriented to time and place. The nurse knows that hallucinations can be explained as option A. Distortions of a real auditory or visual perception. Option B. Sensory experience without foundation in reality. Option C. Voice that is heard by the client but is not really there. Option D, idea without foundation in reality. Hallucination means false perception without external stimuli. यहाँ hallucination explain गर्न भनेको छ. Option B, sensory experience without foundation in reality. Sensory भनेको छ भन्नुको अर्थ यसमा 5 वटै आउँछ. जति पनि हाम्रो सेन्स organ छ 5 वटा त्यो चाहिँ सबै यसमा आउँछ. So question number 82. The nurse assigned the patient is experiencing abnormal cycles of respiration that are increasingly deeper than slower with a possible period of apnea. This type of abnormal type of respiration is called. Option A, crackle. Option B, dyspnea. Option C, kind stroke respiration. And option D, stridor. The right answer is option C, kind stroke respiration. Question number 83. The maximum amount of air a person can expel from the lungs after a maximum inhalation is. Option A, residual volume. Option B, tidal volume. Option C, vital capacity. Option D, inspiratory reserve. Option C, vital capacity is the right answer. यसलाई नर्मल रेस्पिरेसन पनि भन्न मिलिन्छ किनभने यसमा म्याक्सिमम अमाउन्ट अफ एयर लिइराखेको छ र म्याक्सिमम अमाउन्ट अफ एयर पनि के गरिरहेछ त इनहेल पनि गरिरहेछ. एक्सहेल एन्ड इनहेल दुईटै चाहिँ डिपरमा भइराखेको छ. सो रेसिडुअल भोल्युम मिन्स हुन्छ द भोल्युम अफ अनएक्सपेन्डेड एयर डाइट रिमेन्स इन द लङ्स फलोइङ म्याक्सिमम एक्सपाइरेसन. टाइडल भोल्युम मिन्स द अमाउन्ट अफ एयर ब्रेथेड इन और आउट ड्युरिङ द नर्मल रेस्पिरेसन. Vital capacity means the maximum amount of air a person can expel from lungs after maximum inhalation. Question number 84. Trachoma is a disease of. Option A, eyelid. Option B, cornea. Option C, conjunctiva. And option D, lacrimal gland. Trachoma is a eyelid disease. Option A is right answer. Question number 85. A scrub nurse is doing surgical hand washing. Which activity by a scrub nurse during surgical hand wash should be attended by a nurse supervisor? Option A, keeping the hand higher than the arm at all time. Option B, wash each side of the arm 2-3 inches above the elbow. Option C, remove all jewelry like rings, watch, bracelets. Option D, keeping the hand lower than the arm at all times. The right answer is option A, keeping the hand higher than the arm at all time. Question number 86. Which of the following is a common complication of peritoneal dialysis? Option A, peritonitis. Option B, weight gain. Option C, hernia. Option D, inadequate dialysis. Peritonitis. Option A is right answer. The infections of the abdominal lining is known as a peritonitis. Question number 87. Breast self-examination (BSE) is a screening method used in an attempt to detect early cancer. Breast self-examinations can be done in an appropriate way by using option A, pads of fingers. Option B, tip of finger. Option C, palm. And option D, all of the above. Pad of finger use गर्छ. Question number 88. When developing a plan of care for a male adolescent, the nurse considers the child's psychological needs. During adolescence, psychological development focus on option A, becoming industrious. Option B, establishing an identity. Option C, achieving intimacy. And option D, developing initiative. According to Erickson, the primary psychosocial task during adolescence is to establish a personal identity confusion. Option B is right answer. Question number 89. The nephrotic syndrome is characterized by option A, orbital edema. Option B, proteinuria. Option C, hyperlipidemia. And option D, all of the above. The right answer is all of the above, but the main characteristics of the nephrotic syndrome is proteinuria. Question number 90. A nurse observed the foot of diabetic client and found 4-foot gangrene. She recorded the diabetic ulcer as option A grade 1, option B grade 2, option C grade 3 and option D grade 4. The right answer is option D grade 4. ग्रेड 0 मा इन्ट्याक्ट स्किन भएको हुन्छ, ग्रेड 1 मा सुपरफिशियल अल्सर भएको हुन्छ, ग्रेड 2 मा डीप अल्सर टु टेन्डन, बोन और जोइन्ट, ग्रेड 3 मा डीप अल्सर विथ एब्सेस और ओस्टियोमाइलाइटिस एन्ड ग्रेड 4 मा 4-foot ग्याङ्ग्रिन एन्ड ग्रेड 5 मा होल फुट ग्याङ्ग्रिन भएको हुन्छ। यसरी चाहिँ 5वटा 0, 1, 2, 3, 4, 5, 6 सम्म चाहिँ ग्रेडिङ हुन्छ डायबिटिक अल्सरको। क्वेशन नम्बर 91. Which of the following statement truly represent Bell's paralysis? Option A hemiparesis and contralateral facial nerve paralysis. Option B combined paralysis of the facial, trigeminal and abducens nerve. Option C idiopathic ipsilateral paralysis of the facial nerve. And option D facial nerve paralysis with a dry eye. The right answer is option C. Question number 92. Rheumatic fever usually follow an infection with option A Streptococcus group A, option B Staphylococcus aureus, option C Streptococcus viridans and option D as influenza. Rheumatic fever is caused by group A beta hemolytic streptococcus. Option A is right answer. Question number 93. Which valves are commonly affected by rheumatic fever? Option A tricuspid mitral, option B mitral aortic, option C tricuspid pulmonary, option C aortic pulmonary. Mitral and aortic, option B is right answer. Question number 94. Clinical feature likely in 23-year-old man with an accurately inflamed retrocecal appendix include option A right iliac tenderness, option B temperature 37.5 degrees Celsius, option C anorexia and option D all of above. Temperature 37.5 degrees Celsius is the right answer. Question number 85. Which of the following is not a risk factor for osteoporosis? Option A late menopause, option B steroid use, option C sedentary lifestyle and option D low BMI. Low BMI is not a risk factor for osteoporosis. Option D is right answer. Question number 96. Which of the following patients should a nurse recognize as having an increased risk of breast cancer while doing breast cancer screening? Option A 44-year-old who had 5 children, option B 28-year-old who is breastfeeding her first child, option C 35-year-old who started her menstruation cycle at age 12, option D 61-year-old who has not had children. Breast cancer 61 year को ओल्ड फिमेल जसलाई एउटा पनि चिल्ड्रेन छैन त्यस्तो वुमनलाई बडी चाहिँ रिस्कमा हुन्छ। राइट आन्सर इज अप्सन डी 61 इयर को छ र एउटा पनि चिल्ड्रेन छैन भने चाहिँ ब्रेस्ट क्यान्सर हुने चान्सेस बढी हुन्छ। क्वेशन नम्बर 97. A client is admitted to the emergency room with a renal canculi and is complaining of a moderate to severe flank pain and nausea. The client temperature is 100.8 degree Fahrenheit. The priority nursing goal for this client is option A maintain fluid and electrolyte balance, option B control nausea, option C manage pain and option D prevent urinary tract infection. The right answer is option C. The immediate goal of therapy is to elevate the client's temperature. Question number 98. A client has been newly diagnosed with a hypothyroidism and will take a levothyroxine 50 mcg per day by mouth. As a part of teaching plan, the nurse emphasizes that this medication, option A, should be taken in the morning, option B may decrease the client's energy level, option C must be stored in a dark container, and option D will decrease the client's heart rate. Option A is right answer. Thyroid supplement should be taken in the morning to minimize the side effect of insomnia. Question 99. A client comes to the emergency for the treatment of recurrent pelvic inflammatory disease. The nurse recognized that this condition most frequently follow which type of infection? Option A. Trichomoniasis. Option B. Chlamydia. Option C. Streptococcus. And option D. Staphylococcus. Chlamydia infections are one of the most frequent causes of sinusitis and pelvic inflammatory disease. Question number 100. The nurse is performing a neurological assessment on a client post-right CVA, which finding, if observed by the nurse, would warrant immediate attention. Option A. Decrease in level of consciousness. Option B. Loss of bladder control. Option C. Altered sensations to stimuli. And option D. Emotional ability. Option A. Further decrease in the level of consciousness would be indicative of a further progression of the CVA. Question 101. A client is admitted for an MRI. The nurse should question the client regarding option A. Pregnancy. Option B. A titanium hip replacement. Option C. Allergics to antibiotic. And option D. Inability to move his feet. Pregnancy. चाहिँ सोध्नुपर्छ प्रेग्नेन्ट छ कि छैन. Option is right answer. Question 102. A 65-year-old patient is determined to have a systolic blood pressure reading of 125. This patient is option A. Pre-hypertension. Option B. Stage 1 hypertension. Option C. Stage 2 hypertension. And option D. Normal. यो normal हो. Option D is right answer. Old age मा 130 सम्म normal लिन्छ blood pressure. Question 103. Which of the following is not a sign of depression in an older adult? Option A. Impaired speech. Option B. Difficulty sleeping. Option C. Worry about become burden. And option D. Hopelessness. Right answer is option A. Impaired speech. Question number 104. The nurse practitioner is prescribing digoxin and anti-arrhythmic to her 85-year-old patient. The patient asks about risk associated with the combinations. What does the NP say is a potential risk? Option A. Bradycardia. Option B. Hyperkalemia. Option C. Electrolyte imbalance. And option D. Sedation. Bradycardia is right answer. Question number 105. When talking with a pregnant client who is experiencing itching, swallowing, leg pain, the nurse would explain that this is most probably the result of which of the following? Option A. Pressure on a blood vessels from the enlarging uterus. Option B. Thrombophlebitis. Option C. Pregnancy-induced hypertension. And option D. The force of gravity pulling down on the uterus. Pressure of the growing uterus on a blood vessel result in an increased risk for a venous status in the lower extremities. Option A is right answer. Question 106. When conducting a health assessment with a geriatric patient, all but which of the following are appropriate steps? Option A. Minimize distractions in the room. Option B. Speak slowly but clearly to the patient. Option C. Speak slowly and loudly to the patient. And option D. Speak to a family member if necessary to clarify information you receive from the patient. Option C is right answer. यो चाहिँ गर्नु हुँदैन. Speak slowly and loudly to the patient. It is not necessary to speak loudly to geriatric patient, even those with hearing loss. Speak slowly and clearly to patient. Minimize distractions in the room is also a helpful strategy. It is appropriate to ask our family members to clarify information or to provide information that patient struggles with. Option C चाहिँ यसमा आउँदैन. Question number 107. Which of the following urinary symptoms does the pregnant woman most frequently experience during the first trimester? Option A. Burning urination. Option B. Frequency. Option C. Dysuria. And option D. Incontinence. Frequency. Option B is right answer. Pressure and irritations of the bladder by the growing uterus during the first trimester is responsible for causing urinary frequency. Dysuria, incontinence, and burning are symptoms associated with urinary tract infection. Question number 108. Nurse monitors the serum electrolyte level of a client who is taking digoxin. Which of the following electrolyte imbalance is a common cause of digoxin toxicity? Option A. Hypocalcemia. Option B. Hyponatremia. Option C. Hypomagnesemia. And option D. Hypokalemia. Hypokalemia is one of the most common causes of digoxin toxicity. It is necessary that the nurse carefully monitor the potassium levels of the client taking digoxins to avoid toxicity. Low serum potassium level can cause cardiac dysrhythmia. Question 109. A potential concern when caring for a older adult who has diminished hearing and vision would be the client's. Option A. Cognitive impairment. Option B. Feeling of disorientation. Option C. Sensory overload. And option D. Social isolation. Option D. Social isolation is a concern for an older adult who has diminished hearing and vision. Question 110. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing option A. Serum collection drain. Option B. Client's pain. Option C. Nutritional status. Option D. Immobilizer. Bleeding is a common complication of orthopedic surgery. The blood collection device should be checked frequently to ensure that the client is not hemorrhaging. Option A is right answer. Question 111. An elderly client with abdominal surgery is admitted to the unit following surgery in anticipation of complication of anesthesia and narcotic administrations. The nurse should. Option A. Administer oxygen via nasal cannula. Option B. Have Narcan available. Option C. Prepare to administer blood products. And option D. Prepare to do cardiac resuscitation. Narcan is the antidote for narcotic overdose. If hypoxia occurs, the client should have oxygen administrations by the mask, not cannula. There is no data to support the administrations of blood products or cardiac resuscitation, so option A, C and D are incorrect and option B are right. Question number 112. A client with a fractured tibia has a plastic of a Paris cast applied to immobilize fracture. Which action by the nurse indicates understanding of a plasters of Paris cast? The nurse. Option A. Handles the cast with fingertips. Option B. Petals the cast. Option C. Dry the cast with a hair dryer. And option D. Allow 24 hours before bearing weight. Option A is right answer. Handle the cast with the fingertips. Question 113. A mother complains to the clinical nurse that her 2.5-year-old son is not yet toilet trained. She is particularly concerned that although he reliably uses the potty seat for bowel movement, he isn't able to hold his urine for long periods. Which of the following statement by the nurse is correct? Option A. The child should have been trained by age 2 and may have a psychological problem that is responsible for his accidents. Option B. Bladder control is usually achieved before bowel control and the child should be required to sit on the potty seat until he passes urine. Option C. Bowel control is usually achieved before bladder control and the average age for competitions of toilet training varies widely from 24 to 36 months. And option D. The child should be told no each time he waits so that he learns the behavior is unacceptable. The right answer is option C. 24 to 36 months सम्म चाहिँ यो normal हुन्छ. Question number 114. A child is admitted to the hospital with suspected rheumatic fever. Which of the following observation is not confirming of the diagnosis? Option A. or radiate rashes visible over the trunk and extremities. Option B, a history of a sore throat that was self-limited in the past month. Option C, a negative anti-histologies 0 liter. And option D, unexplained fever. Rheumatic fever is caused by untreated group A beta hemolytic streptococcus infection in the previous 2 to 6 weeks, confirming by a positive anti-streptolysis 0 liter. Rheumatic fever is characterized by red rashes over the trunk and extremities as well as fever and other symptoms. Question 115. A hospitalized patient is receiving packed red blood cells for treatment of a severe anemia. Which of the following is the most accurate? Option A. Transfusion reaction is most likely immediate after the infusion is completed. Option B. Packed red blood cells are best infused slowly throughout. Option C. Packed red blood cells should be infused with a 5% dextrose solution. And option D. A nurse should remain in the room during the first 15 minutes of infusion. The right answer is option D. Question 116. A female patient with obsessive compulsive disorders tells the nurse that he must check the lock on his apartment door 25 times before leaving for an appointment. The nurse knows that this behavior represents the patient's attempt to: Option A. Call attention to himself. Option B. Control his thoughts. Option C. Maintain the safety of his home. And option D. Reduce anxiety. Option D. Reduce anxiety is the right answer. Question 117. Which nursing intervention is the most important when retraining a violent male patient? Option A. Reviewing hospital policy regarding how long the patient care be retrained. Option B. Preparing a PRN doses of the patient psychotropic medication. Option C. Checking that the retrain has been applied correctly. And option D. Asking if the patient needs to use the bathroom or is thirsty. The right answer is option A. Question 118. The nurse is assigned to care for a recently admitted female client who has attempted suicide. What should the nurse do? Option A. Search the client's belongings and room carefully for items that could be used to attempt suicide. Option B. Express trust that the client won't cause self-harm while in the facility. Option C. Respect the client's privacy to not searching any belongings. Option D. Remind all staffs remember to check on the clients frequently. Option D is right answer. Question number 19. When teaching a client with a coronary artery disease about nutrition, the nurse should emphasize: Option A. Eating 3 balanced meals a day. Option B. Adding complex carbohydrate. Option C. Avoiding very heavy meals. And option D. Limiting sodium to 7 grams per day. The right answer is option C. Avoiding heavy meals. Question 112. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? Option A. Sexual contact with an infected partner. Option B. Contaminated food. Option C. Blood transfusion. And option D. Illegal drug uses. Hepatitis A is the only type that is transmitted by the fecal oral route. Option B is right answer. Hepatitis B, C and D are transmitted through infected bloody fluid. Question 121. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? Option A. The patient must maintain a low-calorie diet. Option B. The patient must maintain a high-protein, low-carbohydrate diet. Option C. The patient should limit sweet and sugar drinks. Option D. The patient should limit fatty foods. Option D is right answer. Inflammation of gallbladder. is most commonly caused by the presence of a gallstone, which may block bile from entering the intestine. Patients should decrease the dietary fatty by limiting food like fatty meats, avoid irritations of the gallbladder. Question number 122. After undergoing a transurethral resection of the prostate to treat benign prostatic hypertrophy, a patient is returned to the room with a continuous bladder irrigation in place. One day later, the patient reports bladder pain. What should the nurse do first? Option A. Increase the IV flow rate. Option B. Notify the doctor immediately. Option C. Assess the irrigation catheter for patency and drainage. And option D. Administers mederidine as prescribed. The right answer is option C. Question 123. The nurse is drawing blood from the diabetic patient for a glycosylated hemoglobin test. She explains to the woman that the test is used to determine option A. The highest glucose level in the past week. Option B. Her insulin level. Option C. Glucose level over the past severe month. And option D. Her usual fasting glucose level. Option C is right answer. Glucose level over the past several months. Question 124. A nurse is assessing a patient and notes a Brudzinski sign and Corning sign. These are two clinical signs of which of the following disorder? Option A. Cerebrovascular accident. Option B. Meningitis. Option C. Seizure disorder. And option D. Parkinson's disease. You have meningitis cosine symptoms, so option B is right answer. Question number 125. An 89-year-old male lives alone independently. Following his inguinal hernia repair, which stitching method would be most effective for post-operative and discharge stitching? Option A. Explaining. Option B. Demonstrating. Option C. Giving written materials. Option D. Explaining all instructions to a family member. Demonstrating is right answer. Option B. Question 126. A nurse in the post-anesthesia care unit notes that a client's left pupil is larger than the right pupil. The nurse should option A. Check the anesthesiologist. Option B. Notify the anesthesiologist immediately. Option C. Notify the surgeons after administering oxygen. And option D. Evaluate the client's level of consciousness using the Glascow Coma Scale. The right answer is option D. Question number 127. After admissions to the post-surgical floor following a bowel resection, a client's urine output dropped from 40 ml per hour to 18 ml per hour. Which of the following is the most likely causes of decreased urine output in this client? Option A. Bladder distension. Option B. Bleeding. Option C. Bowel obstruction. And option D. Kidney failure. The right answer is option B. Bleeding. Question 128. Increased age, dehydration and the use of NSAID increase the risk of option A. Renal failure. Option B. Liver failure. Option C. Hypotension. And option D. Hypertension. Increase the risk of renal failure. Option A is right answer. Question 129. A patient with thrombophlebitis disease her expected outcomes of care. Her affected leg appears pink and warm. Her pedal pulse is palpable and there is no edema present. Which step in the nursing process is described above? Option A. Planning. Option B. Implementation. Option C. Analysis. And option D. Evaluation. Your evaluation option D is right answer. Question number 130. When caring for a patient with esophagus varices, the nurse knows that bleeding in this disorder usually stems from option A. Esophageal perforation. Option B. Pulmonary hypertension. Option C. portal hypertension. And option D. Peptic ulcer. Option C. Portal hypertension is right answer. Question number 131. A pediatric nurse has been assigned to work with a pediatric patient with airborne precautions. All of the following illnesses would require airborne precaution except option A chickenpox, option B measles, option C human immunodeficiency virus, and option D tuberculosis. The right answer is option C. Human deficiency virus does not require airborne precaution. Question 132. A nurse is caring for a pediatric patient with a droplet precaution. What would be the most appropriate actions of protection for the nurse to practice? Option A. Use a mask. Option B. Wear gloves. Option C. Wear a gown, gloves and mask. Option D. Wash hands between patients. The right answer is option A. Use a mask. The use of mask is necessary when a client has a droplet precaution. Question 133. Considering the physical development period of a 1-year-old, hospitalization may affect or delay his progression with option A. Walking, option B. Crawling, option C. Running, and option D. Sitting. Option A. Walking is the right answer. Question number 134. Which of the following oxygen delivery device deliver accurate concentration of oxygen? Option A. Nasal cannula. Option B. Partial rebreather mask. Option C. Simple face mask. Option D. Venture mask. The right answer is option D. Venture mask. बाट चाहिँ 24 to 60% oxygen चाहिँ deliver हुन्छ. Question 135. All of the following are important in the immediate care of the premature neonate. Which nursing activity should have the greater priority? Option A. Installations of antibiotic in the eyes. Option B. Identification by bracelets and footprints. Option C. Placement in a warm environment. And option D. Neurological assessment to determine the gestational age. The right answer is option C. Placement in a warm environment. Question 136. Which of the following components help to prevent a neural tube defect? Option A. Vitamin A. Option B. Calcium. Option C. Folic acid. And option D. Iron. Folic acid. Option C is the right answer. Question 137. A client is complaining of her painful contractions or after pains on postpartum day 2. Which of the following conditions could increase the severity of after pain? Option A. Bottle feeding. Option B. Diabetes. Option C. Multiple gestation. And option D. Premiparity. Multiple gestation is the right answer. Question 138. According to Erickson's 8 stages of psychological development, during which age does the psychological stage of trust versus mistrust develop? Option A. Early childhood. Option B. Infancy. Option C. Adolescence. And option D. Adulthood. Option B is right answer. Infancy. Question 139. A child has acute lymphocytic leukemia. The nurse is planning a room assignment. Which of the following will be the best choice? Option A. Private room. Option B. A room with another child with leukemia. Option C. A 4-bed room with the children in his age. And option D. A bed in intensive care. A private room. Option A is right answer. Question 140. You are observing a 5-month-old for developmental skill. Which of the following skill would concern you if the infant was not demonstrating? Option A. Crawling. Option B. Follow objective with eyes. Option C. Sitting with support. And option D. Grabs objects. The right answer is option D. Grabs objects. Question 141. A 18-year-old boy was admitted to the medicine unit with a diagnosis of tetanus due to previous nail puncture and appropriate nursing intervention for a patient. Option A. Decrease the environmental stimulation. Option B. Suction by nasopharyngeal route. Option C, gently massage the large joint, and option G, frequently assess level of consciousness. Option A is right answer. Question 142. A child with severe malnutrition show clinical manifestation like gross muscle wasting, edema, and dry eye. Option A, marasmus. Option B, quasi-worker. Option C, pellagra, and option D, beriberi. Option B, quasi-worker is right answer. Question number 143. When developing a plan care for a hospitalized child, nurse no diet, children in which age group are most likely to view illness as a punishment for misstated? Option A, infancy. Option B, preschool age. Option C, school age, and option D, adolescent. Option B, preschool age is right answer. Question 144. A child is diagnosed of a severe mental retardation. What will be IQ of a child? Option A, IQ 50 to 55 to approximately 70. Option B, IQ 35 to 40 to 50 to 55. Option C, IQ 20 to 25 to 35 to 40. Option D, IQ below 20 or 25. Option C is right answer. Question 145. Doctor prescribe corticosteroids for a child with nephrotic syndrome. What is the primary purpose of administering corticosteroid to this child? Option A, to increase blood pressure. Option B, to reduce inflammation. Option C, to decrease proteinuria, and option D, to prevent infection. To decrease proteinuria. Option C is right answer. Question number 146. At birth, a newborn infant is noted to have the following finding: heart rate 70 per minute, respiratory effort poor and irregular, limb no flax irritability, blue all over the body. The Apgar score of the baby at this point is option A 0, option B 1, option C 2, and option D 3. So 0 so option C 2 is right answer. Question 147. While assessing a 1-month-old infant, which findings should the nurse report immediately? Option A, abdominal respirations. Option B, irregular breathing rate. Option C, inspiratory grunt. Option D, increased heart rate with a crying. Option C is right answer. Question 148. A full-term male has a hypospadias. Which statement describe hypospadias? Option A, the urethral opening is absent. Option B, the urethral opens on the underside of the penis. Option C, the penis is shorter than usual. And option D, the urethral meatus open on the underside of the penis. The urethral open on the underside of the penis. Option B is right answer. Question number 149. A child is admitted to the hospital several days after stepping on a sharp object that punctured her athletic shoes and injured the flesh of her foot. The physician is concerned about osteomyelitis and has ordered parenteral antibiotic. Which of the following action is done immediately before the antibiotic is started? Option A, the admissions ordered are written. Option B, a blood culture is drawn. Option C, a complete blood count with a differential is drawn. Option D, the parents arrive. Option B is right answer. Question number 150. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testis in the scrotal sac. Which of the following statement about the undescended testis is the most accurate? Option A, normally the testes are descended by birth. Option B, the infant will likely require surgical intervention. Option C, the infant probably has a with only testes. And option D, normally the testes descended by 1 year of age. Normally, the testis descended by 1 year of age. Option D is right answer. Nepal Nursing Council NNC exam नेपालमा 1996 देखि भइराखेको छ र त्यतिखेर सुरुमा चाहिँ 200 क्वेशन सोध्ने गरिन्थ्यो। सो यो पहिलाको सेट हो र यसमा 200 क्वेशन छ। रिमेनिङ क्वेशन नेक्स्ट सेटमा इन्भल्भ गर्नेछु। थ्यांक यू सो मच एन्ड अल द बेस्ट टु अल।